Please check, dear students. Now audio is okay. Give me the thumbs up in chat box. We are going to start one another very beautiful, energetic session, knowledgeful session. Okay, yes, thank you. Thank you, Uzma. So I think everything is okay. So we are going to start without delay. Hello, dear friends. Very warm welcome to all of you at our conceptual brainstorming integrated session of anatomy at this beautiful platform, Cerebellum Academy. So after yesterday class over the brachial plexus and the beautiful clinical integration with the orthopedics and the surgery, now we are going to talk regarding our important nerves of the upper limb. So yes, this is our today's topic, nerves of upper limb. We are going to integrate with the different our clinical topics according to the next pattern, as well as for our university exam. Again, I want to recall you, this is the session mainly for the first MBBS students. The Cerebellum team is trying to help for our university going students in this duration who are having the exams after 2 months. So we are going to start this session. Hope everything is fine. Nerves of upper limb, part 2 by the Dr. Shrikant Verma, Cerebellum Academy. So what are the different important questions for the first MBBS students? Long notes are asked. Can you see here, beta? Sir, there is a question. Describe the median nerve or the ulnar nerve or the radial nerve under the following headings, and it is the question for the 10 marks. Yes, how these are formed, what is the course, and what is the branches, and yes, different pointers of the different our clinical points. Agree, beta? Now try to get what are the different short notes which are asked from this zone. Describe the median nerve, its course and branches in forearm, because median nerve is the laborer nerve. It is the main nerve of the forearm. That's why. Also, the median nerve separately 5 marks question is asked. The course and its branches in the hand. Also remember the ulnar nerve. This is the musician nerve, main nerve of the hand, which is supplying the short intrinsic muscle. So it is asked in the hand, 5 marks. And the radial nerve, it is having the different branches in the our arm portion. So this is another 5 mark question for all of you. So according to the different states and different universities, we are making the important question. No excuse with this topics with this question. So we are starting our today's session with the median nerve. So try to understand. Yesterday we had seen all the nerves of the brachial plexus. Sir, yes, all the nerves of the upper limb, they are formed by the brachial plexus. Do you remember? In our brachial plexus, there was our lateral cord and the medial cord. Yes, sir. The lateral cord, it was giving rise to the lateral root. Medial cord, it was making the medial root, and both are uniting to make the median nerve. In yesterday class, we had seen, sir, median nerve is having the 2 roots, lateral root and our, yes, medial root. Correct, sir? So there are the 2 roots, lateral root and the medial root, which is making the median nerve. So one diagrammatic presentation as well as our 3-dimensional orientation, how the median nerve is running in our upper limb part with our Tony Stark Iron Man style. Can you see here? Sir, the bunch of the nerves, yes, it is coming from our brachial plexus. Can you see the median nerve? Yes, sir. This is our median nerve, which is arising from the brachial plexus, having the 2 roots, lateral root and medial root. Okay, sir. Now this median nerve is running in the arm. Remember, it is giving no branches in the arm. Then it is running in our, yes, it is coming into the cubital fossa. Do you remember? MBBR, beta exam pass hai. Kam se kam itna jarur yaad rakhna, in the arm, it is not giving any branch. Then it is coming into our cubital fossa. Yes, there is a relation MBBR. Also remember, in your textbook it is given, this median nerve is giving the vasomotor branches to the axillary artery and our, yes, you can say brachial artery, but that is not important, so you can skip. So MBBR, M for median nerve, then there is a brachial artery, then there is a biceps tendon, and then there is a radial nerve. Okay, sir. Now it is reaching into our, yes, forearm. It is the main nerve of the anterior compartment of the forearm. Yes, remember all the muscles of the anterior compartment of the forearm, these are supplied by the median nerve except flexor carpi ulnaris and flexor digitorum profundus. Why? क्योंकि बेटा ये जो मसल्स हैं ये मीडियल साइड की है, एंड आई टोल्ड यू जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. एंड ऑन द मीडियल साइड सर देयर इज अ अल्नर नर्व, सो अल्नर नर्व विल सप्लाई टू द flexor carpi ulnaris and flexor digitorum profundus. Remaining all are supplied by this median nerve. Now this median nerve is going towards the our hand, and remember it is passing through the very important structure, that is our, yes, flexor reticula. So it is passing below the flexor reticula where there is our tunnel at the carpal region. So it is passing below the carpal tunnel. It is dividing into the different branches. It will give the many muscles of the our hand. Yes, thumb muscles, they are supplied by the median nerve except adductor pollicis thenar muscle. And remember the first and second lumbrical, these are supplied by the median nerve because these are located here. मैंने फिर से आपको हमेशा मैं ये कहता रहूंगा, median nerve is passing from the thumb side, so it will supply the muscles of the thumb, it will supply the skin near the thumb. जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है, our Hilton law. Okay sir, while the ulnar nerve will pass through the ulnar side. Okay, so here it is giving the sensory and the motor branches. So with this three-dimensional orientation, we are going to understand our, yes, this diagrammatic presentation. Yes, Nimit Malik, hello beta. Hope you all are having all the things proper with the clear concept. Please watch yesterday video. Okay, and yes, make this session interactive so that we all can enjoy this one. Okay, so remember always, you have to focus over your target. कौन कहता है आसमान में सुराख नहीं हो सकता, तबीयत से एक पत्थर तो उछालो यारो. याद रखो बच्चों, आपका एग्जाम पास है, लेकिन अगर हम प्रॉपर फोकस करते हुए इस चीज को क्रैक करें, फर्स्ट एमबीबीएस में अगर हमारे अच्छे नंबर आते हैं, तो पूरा एंटायर एमबीबीएस लाइफ हमारा बहुत स्मूथ जाता है. ओके सर, सो व्हाट आई वांट टू टेल यू, मीडियन नर्व. सर, दिस मीडियन नर्व is having the two roots. One simple diagrammatic presentation, quick revision for your exams. Yes. So one diagrammatic presentation. Can you see? There is a brachial plexus. Here are the lateral root and medial root. Now median nerve is formed. Yes, it is running in the arm. It will give no branch. Yes, here there is our muscle, coracobrachialis muscle, from where the medial intermuscular septa starts. Getting the point? Remember, this median nerve is coming, fine, and it is running in the our anterior compartment. And yes, there is our also the brachial artery. The brachial artery, axillary artery is coming. The brachial artery is coming here. Initially, the median nerve is lateral to the brachial artery, but at the level of the coracobrachialis insertion, it is crossing. It is very important viva question. At the CBI, coracobrachialis insertion, it is crossing the artery from lateral to the medial side. Okay, sir. And then it is running medially. At the cubital fossa, we all know the relation is the MBB and another nerve is R. So remember, labeling for all of you, sir, it is having the lateral root, it is having the medial root, and these are making the median nerve. Yes, sir. This is our brachial artery. Remember, at coracobrachialis insertion, this median nerve is crossing the brachial artery from lateral to the medial side. Very important viva question. And here in the cubital fossa, we all are aware, sir, relation is M, B, B and R. Sir, M for median nerve, B for brachial artery, B for biceps tendon, and R for radial nerve. These relations are from medial to lateral. But no excuse. सोते, जागते, उठते, बैठते, खाते, पीते, ये याद रहना ही चाहिए. Now, this nerve is running in our forearm anterior compartment. Yes, Varun. Hello, beta. Hope you all are getting the point. Yes, Shashank is here. Yes, so today there was the our FMG exam, and Shashank is saying that a little bit anatomy questions were tough. You are right, beta. First session was tough, and these basic questions were difficult, and especially the anatomy, directly 8 or 9 question came, and with the integration to the other subject, many other questions. Okay. Yes. Good evening, Shreya. Kaise ho, beta? Okay. Yes, medial most structure. So hope you are getting the point. Anything you can comment. I am looking. I'm having one eye over the chat box also. Okay, beta. Okay, yes. So now, when this nerve is reaching into the entry compartment, there is a one muscle, pronator teres. This pronator teres is having the two head, superficial head and the deep head. So this nerve is passing in between these two head. Remember one very important clinical, if there is the compression of the median nerve in between the two heads of, yes, pronator teres muscle, this is our pronator teres syndrome. This is your clinical question. What I want to tell you, this is the median nerve which is passing in between the two heads of the pronator teres muscle. Sometimes this median nerve is compressed in between the two heads of the pronator teres muscle. This is known as pronator teres syndrome. Now, this nerve is running in our forearm. Here it is giving one deep branch. Yes, sir. This deep branch is running in front of the interosseous membrane. What should be the name? Sir, this is anterior interosseous nerve. Important. What is this anterior interosseous nerve, beta? Remember, it is the our deep branch of median nerve. Getting the point? Now, here over the carpal bone, you all know there is our one modification of the deep fascia. This deep fascia modification is responsible for making the tunnel. Yes, it is making the one canal which is responsible for the retention of the long flexor tendon. Can you see? Yes. Look at this structure. You all are aware about the different kind of our carpal bone. Yes, she looks too pretty. Try to catch her. Means escaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. Over this all structure, you can see one modification of the deep fascia. Just below it, there is the one tunnel. Dhyan se dekho beta, 3-dimensional anatomy. Yes, sir. There is a one canal. This is located over the carpal bone. So this is our carpal tunnel. Remember, the median nerve will pass below it. This structure is responsible for retaining, for holding the flexor tendon. That's why it is known as the flexor retenacula, flexor retenacula. नाम को तोड़ो और सोचो फिर से. अर्ज किया है, शेक्सपियर ने कहा है नाम में क्या रखा है, लेकिन हम इंडियन तो मिर्जा गालिब के दीवाने हैं. मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. Flexor retenacula, it is retaining the flexor tendon. That's why sometimes short notes are asked about this question also. Yes, Uzma, you are right, beta. Yes. Okay. So now this nerve is coming and it is passing below the flexor retenacula. Yes, sir. If here is a compression of the median nerve, then there is a carpal tunnel syndrome. Very important short note for the first MBBS students as well as MCQs. Okay. Now this nerve will give the motor branch and the sensory branch. Just diagrammatic presentation. Sir, it will supply the lateral 3.5 of the finger. It will supply all the thenar muscle. Yes, thumb side muscle, except adductor pollicis, and it will supply the first and second lumbrical. Means only the 5 muscles. So this is the point which you must remember. Okay. Now what I want to tell you, this is the one diagrammatic presentation of the median nerve. You have to draw this diagram. See here how you will show formation of the median nerve, then course in the axilla, then in arm, then how it is running in the forearm, then how it is running in the hand. So this is the way how you have to describe. Sir, any nerve, first you have to say about the formation, then course in axilla, then from axilla into the arm, then from the arm into the forearm, then into the hand. Okay, so let's start this one. आराम से बेटा, बहुत आसानी से समझ में आएगा. Sir, this median nerve was formed with the help of the 2 roots, lateral root, medial root. Agree, sir? Lateral root is formed by the C5, C6, C7. Correct, sir? While the medial root is formed by the C8 and T1. Done. Now this median nerve is running in the axilla. How many branches? No branches. Your Viva question, MCQ. Now it is reaching into the arm. Correct, sir. Important point. It is crossing the brachial artery, sir. It is crossing the brachial artery from lateral to the medial side. Getting the point? Yes, it is crossing our brachial artery from the lateral to the medial side. Now it is reaching into our cubital fossa, and we all are aware about the relation MBB and R for radial nerve, which is not shown in this image. Median nerve, then brachial artery, then our biceps tendon, and then there is the location of the radial nerve showing with the yellow color. Now this nerve is coming and it is passing in between the two heads of the which muscle, sir? Pronator teres muscle. Yes, it is the short, sweet, quick revision series for the first MBBS students for your exam help. So I am taking the help of this picture. Okay, and again I want to tell you, this annotated file you will get within our Cerebellum app. Okay, yes, this is our pronator teres muscle. It is piercing the pronator teres. Remember, this is the very important MCQ, that this median nerve pierces which muscle? Pronator teres. It is passing in between these two. So if there is a compression, I told you pronator teres syndrome. Okay, now it is giving one deep branch, which is the anterior interosseous nerve. Remember this nerve, very important, your Viva and MCQ. Anterior interosseous nerve is nothing, sir. It is the deep branch of the median nerve. What it will do? It will supply all the deep muscles of the anterior compartment of the flexor compartment. Okay. Yes, all the tendons, all the muscles of our deep compartment, deep part of the anterior compartment. What are the deep muscles? Try to remember. Flexor. Yes, responsible for the flexion of the thumb. Flexor pollicis longus. Another is flexor digitorum profundus. Remember the flexor digitorum profundus. It is hybrid muscle. The lateral half is supplied by anterior interosseous nerve, median nerve, but medial half is supplied by ulnar nerve. क्योंकि medial की तरफ किसकी नदी है? Ulnar nerve की. Lateral की तरफ किसकी नदी है? Median nerve की. And then it is supplying the pronator quadratus muscle. It is supplying the wrist and inferior radial ulnar joint, and it is getting end. Okay, sir. But this, our superficial branch, it will supply all the superficial muscles. What are the different superficial muscle? Yes, it will supply to the pronator teres. It will supply the flexor carpi radialis. Think about it. Naam ko todo aur socho. It is taking origin from the flexor point. It will go towards the carpal bone and it is running towards the radial side. That's why it is supplying the next muscle, palmaris longus. It is supplying the flexor digitorum superficialis. Okay, sir. Now it is running in between the flexor digitorum superficialis and flexor carpi radialis, and then it is running deep to this flexor retinacular. Remember, it is running deep to this flexor retinacular within the carpal tunnel. So very important question. If there is a damage, there is a carpal tunnel syndrome. Getting the point, beta? Okay. Okay. Yes. Yes, Varun. It will be very helpful for the revision of the clinical subjects also. You are right, beta. Now, see, it is important what is the course of this median nerve in the hand. So you can see it is giving one palmar cutaneous branch, lateral half of the palmar skin before the flexor retinacula. So if there is a carpal tunnel syndrome, remember the sensation over the thinner eminence will be normal. Kyun? Because this cutaneous branch is given before the flexor retinacula over this thinner eminence part. Okay. While you can see here it is giving the muscular branches, and these muscular branches are supplying all the thinner muscle. You can remember with the AFO. AFO is your mnemonic. A for abductor. It is acting over the thumb. That's a pollicis, a small muscle. That's a brevis. Next is flexor pollicis brevis. Next is opponens pollicis. Except adductor pollicis. Adductor pollicis is the graveyard of the ulnar nerve. So it is supplied by our ulnar nerve. And you can see it is supplying the first and second lumbrical also. And then it is giving the digital branches, which is supplying the lateral thin half, 1, 2, 3, and half of the skin on the palmar side. And at the back, these nerves are taking turn and supplying the nail beds part. Agree, beta? So this is the one very useful diagram. It will be available in our app as the annotated file. Now, what are the important clinical integration from where the Viva question, MCQs, as well as sometimes the short questions are asked. So what are the different tests for the median nerve? So remember the Captain America joined the Avenger team. क्यों? क्योंकि वो एमबीबीएस नहीं कर पाया, वो सिर्फ बैचलर इन फिजियोथेरेपी रह गया. So this is the one funny mnemonic. The Captain America was the bachelor in physiotherapy. So our mnemonic is CAP BPT. So remember the median nerve, sir, median nerve is having injury and it will manifest with the C for carpal tunnel syndrome. Remember, recall, revise with me. A for apt thumb deformity. Yes, P for pointing index, which is also known as the Oshner clasper test. Then B for Benedict hand, also known as the Pope hand deformity. Then P for Fallon test, also P for, you can remember, the pain test, and T for Tinel sign. So these all are tests related with the median nerve. No excuse. Hope you all will like this mnemonic. Okay, beta. Now we are looking one by one the important clinical point. So first is our carpal tunnel syndrome. I'm looking for any chat. Okay, yes, okay. Atul is here. So thank you, Atul, for joining. So any kind of the doubt you can ask. First, we are talking about our carpal tunnel syndrome. We all know, sir, there is our flexor retinaculum. Beta first MBBS के बच्चों को जब external आएंगे एग्जाम लेने के लिए पूछेंगे, where is the location of the flexor retinaculum? Show with the two finger. तो बेटा 2 उंगलियां रखनी है अपने फ्लेक्सर, अपने कार्पल बोन के ऊपर. सर, इट इज द लोकेशन ऑफ द आवर फ्लेक्सर रेटिकुलर थ्रू विच below it the our median nerve is coming and it is giving the sensory and the motor branches. Can you see 1 2 3 and half of the finger they are supplied by the our median nerve? What happens? Remember, due to autoimmune disease, one etiology, due to the myxedema, due to the pregnancy or the computer typewriter, they are having repeated injury or compression of the median nerve below the flexor retinaculum or the carpal tunnel. Sir, it is the carpal tunnel syndrome. There is the sensory abnormality along the 3 and half of the digit, as well as there is a compression of the median nerve. So there is a thenar atrophy. You will see the apt thumb deformity. Yes, so this is important point. What you will see the other signs? Yes, Tinel sign you will get in case of the carpal tunnel syndrome. Very, very important. Remember, you have to tap over the flexor retinacula. So the patient will say there is an increase in the pain along the lateral 3 and half of the finger. Sir, it is the positive Tinel sign. Remember, this positive Tinel sign is found positive in case of the कार्पल टनल सिंड्रोम. तो सोचो बेटा, अगर आपका कार्पल टनल सिंड्रोम शॉर्ट नोट है, आपने टिनल साइन भी लिखा, कितना बढ़िया आपको नंबर मिलेगा. यस, नाउ सी द फैलेंस टेस्ट. सो यू हैव टू आस्क द पेशेंट टू डू दिस मैनूवर, excessive flexion at the wrist joint. So in this condition, the median nerve is getting compressed just below the flexor retinaculum. So you will observe there is the increase in pain along the lateral 3 and half of the finger. Again, remember, it is positive in case of the carpal tunnel syndrome. So it is the test for the median nerve. How you can remember? One funny thing, just tap over this. Okay, जैसा मैं कर रहा हूं वैसा करो. Yes, tapping, 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 tinel, 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 fall, 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 Fallon, Fallon, Fallon. Both are the test for the our carpal tunnel syndrome. Both are the test for the median nerve. So funny way, आपको टैपिंग करना है कार्पल टनल के ऊपर, दिस इज द टिनल साइन. आपको फॉल करना है हैंड को ऑपोजिट वे में, फॉल कर रहे हैं तो फैलेंस साइन. तो नहीं पढ़ने के 100 बहाने, लेकिन पढ़ने के 1000 बहाने. आप इसे बहुत ही आसानी से याद रख सकते हैं. नाउ लुक हियर, इफ वी ऑल आर फैन ऑफ द our yes Jacqueline Fernandez auntie, then we will miss all the concept. क्योंकि ये कहती है चिटिया कलाइयां वे, yes मंजावे, मैनू शॉपिंग करा दे, मैनू पिक्चर दिखा दे. लेकिन आपने देखा होगा कोई इसको पिक्चर नहीं दिखा रहा, कोई इसको शॉपिंग नहीं करवा रहा. क्यों? क्योंकि ये कहती है कि कलाई यहां पर है. रिमेंबर, योर एक्सटर्नल विल कम एंड ही विल आस्क वेयर इज योर रिस्ट. ये बेटा रिस्ट नहीं है, रेडियो कार्पल जॉइंट इज बिलो और इसके ऊपर में कार्पल बोन है, तो यहां पर फ्लेक्सर रेटिकुलम होता है. व्हाई आई एम टेलिंग, सी हियर, कार्पल टनल सिंड्रोम, एनी नर्व कंप्रेशन, व्हाट यू हैव टू डू, नर्व का कंप्रेशन है तो आपको नर्व को स्ट्रांग बनाना पड़ेगा. बायोकेमिस्ट्री इंटीग्रेशन, यू हैव टू गिव द विटामिन B1, B2, B9, B12, yes, B6 means multivitamin you have to give. You have to ask the patient treatment. I'm telling you, yes, you have to ask the patient for the exercise, but if not treated, then give the painkiller. If not treated, then give the steroid, the best anti-inflammatory drug. Okay, लेकिन अगर इससे भी ठीक नहीं हुआ तो सर्जरी. और अगर आप जैकलिन आंटी के फैन हैं तो सिचुएशन में कलाई यहां है बोलेंगे, लेकिन बेटा कलाई यहां नहीं है. कलाई अगर आप यहां है तो यहां इंसिजन मारेंगे और उस कंडीशन में फिर खोजते रहेंगे, अरे फ्लेक्सर रेटिकुलम किधर गया किधर गया, आपको मिलेगा ही नहीं. फ्लेक्सर रेटिनाकुला इज लोकेटेड ओवर द आवर कार्पल बोन, सो यू हैव टू गिव द इंसिजन हियर. रिमेंबर, एक अच्छा सर्जन बेटा वो है जो मिनिमम इंसिजन देता है, मिनिमम स्कार प्रोड्यूस करता है, उसे लोग ज्यादा पसंद करते हैं. नोबडी लाइक्स द अगली स्कार. तो आपको ये एनाटॉमी जो है सर्जरी में, ऑर्थोपेडिक्स में हेल्प करेगी. यू हैव टू कट द फ्लेक्सर रेटिनाकुला, यू हैव टू रिलीव द प्रेशर. दिस इज ऑल अबाउट आवर शॉर्ट नोट फॉर द carpal tunnel syndrome. Very important. Now, aphthum deformity, we all know the median nerve is coming from this side. So if there is a compression of this median nerve, there is atrophy of the thenar muscle, it becomes flat. So this is appearing just like the thumb of the ape monkeys. That's what is our aphthum deformity. Remember, it is due to the median nerve damage. Getting the point? Yes, yes, Uzma, auntie, we will say, so that we can remember for the better time. Now, this is the one beautiful median nerve test, Pope hand deformity, benediction hand deformity. Remember, if median nerve is getting injured at the our cubital fossa part, then you will ask the patient to flex the finger. He will not be able to flex the finger. But do you remember the flexor digitorum profundus, the hybrid muscle? The medial half is supplied by which nerve? Answer is ulnar nerve. So ulnar nerve is okay. So patient will be able to flex the flexor digitorum profundus. So the both fingers will be flexed in this way. So the patient hand will be in such kind of the manner when there is an injury at our cubital fossa. And this position is just like the hand position of our Lord Yeshua Masih, or you can say one Pope Benedict. So this is the median nerve injury at the cubital fossa. This is the Pope hand deformity or benediction hand deformity. Now this is the your MCQ NEET PG 2021. बेटा यहीं से तो क्वेश्चन आने वाले. अगर आपका एनाटॉमी स्ट्रांग रहेगा, yes, your all the 18 subject will be strong, you will perform very good in all the other subject. इसलिए बेटा मैं एक चीज कहता हूं मेरे बच्चों, मैंने कहा था ना 18 सब्जेक्ट पढ़ने से पहले एनाटॉमी पढ़ा जाता है. सो दिस इज द वन फेमस डायलॉग फ्रॉम माय क्लासेस इन स्टाइल ऑफ द शकुनी मामा. तो बेटा अगर आपका एनाटॉमी स्ट्रांग है तो हर चीज स्ट्रांग होगी. यस, हाउ यू विल टेस्ट द मीडियन नर्व, नीट पीजी 2021 क्वेश्चन. यू हैव टू आस्क द पेशेंट टू टच द पेन. इन दिस ग्रीन बैकग्राउंड आई एम शोइंग यू. यस सर, द पेशेंट विल abduct the thumb. Getting the point? If he is touching the thumb, means proper abduction is there, means abductor, pollicis brevis is okay, means median nerve is okay. But if patient is not able to touch the pain, means there is a damage in the our median nerve. So remember, it is the test for the median nerve. Getting the point, beta? Now see here, pointing index. What you have to remember, if there is the injury to the our median nerve at the mid forearm, yes, there is the damage at the mid forearm part. Now you will ask the patient to flex the finger. So definitely the ulnar nerve is okay, flexor digitorum profundus is okay, so these two fingers will be flexed. But remember, these all are associated together and the injury is lower, so the few fibers which are supplying this middle finger, yes, that will be also flexed. Also one fact is written in your textbook, that this all the tendons are in common synovial sheath, so automatically with this two finger, this middle finger is flexed. But this finger which is totally destroyed, yes, the nerve fibers which are supplying to this index finger, it is remaining, yes, this is getting damaged, so these fibers are remaining intact. This fiber which is supplying to the index finger, it is damaged, so the patient will present with the pointing index. This finger will point towards the doctor. So this is your pointing index. Remember beta, pointing index is found in case of the mid forearm injury. Okay, now try to catch this another one, Auschner clasp test. This is nothing, you have to ask the patient to make the fist. But when there is the injury to the median nerve at the mid forearm, definitely this finger will point towards the doctor. So this is nothing, the pointing index is the Auschner clasp test. Pointing index is the Auschner clasp test. Different country, different author, different way to explain. Okay, now see here, there is a one our another sign, okay sign. This is found positive in case of the, yes, remember, anterior introitious nerve damage. So remember, Salmon boy, आज गाड़ी तेरा भाई चलाएगा. Okay, so what is the our okay sign? Anterior introitious nerve syndrome. Normally when we make this okay, can you do this one? What is happening? There is a flexion of this our index finger, there is a flexion of the thumb. Okay, yes, remember, the flexion of the thumb is done by the flexor our pollicis brevis, and index finger is also getting flexed. Okay, sir. So at this time, remember this flexor pollicis brevis is supplied by which nerve? Sir, deep branch of the median nerve, entry introsseous nerve. Getting the point? But if there is damage to the entry introsseous nerve, the patient cannot make the flexion properly. Okay, so here no flexion, but he will present with such kind of presentation. So this will be the presentation. He cannot make the proper okay. Getting the point? Okay. So this is your, yes, entry introsseous nerve syndrome. Remember, this index finger is supplied by the flexor digitorum profundus lateral tendon, okay, which is also supplied by the our entry introsseous nerve. So what is resulting? The patient is not able to flex the thumb, not able to flex the your, yes, this index finger. So he will not make the proper circle, but he will present with such kind of the finger presentation. Why? Because of the damage to the entry introsseous nerve, the flexor digitorum profundus as well as the flexor pollicis longus, these are paralyzed. Getting the point? Now look here, we are coming for our ulnar nerve part. Okay, sir. So in the similar way, first you have to describe the formation, then you have to describe the course in the axilla, then in the arm, then in the our cubital fossa region, then in the forearm, and then in the hand. So this ulnar nerve, sir, it is having the two roots C81, but few contribution from the C7 also. Yes, it is the branch from the medial cord. The ulnar nerve is running, but here is the our, yes, medial intermuscular septa. So it is important question. It is piercing the medial intermuscular septa, and then it is passing to the posterior compartment. Our ulnar nerve is passing from anterior compartment to the posterior compartment, and then it is passing behind the our, yes, medial epicondyle. So this is very, very important relation. It is running behind the medial epicondyle. Many important question I am telling you. Yes, this is at the our coracobrachialis insertion. Remember, it is having the root value C7, C8, and the T1. Hope you all are getting the point. I'm looking for the any doubt by all of you. Okay, sir. Now what I want to tell you, yes, sir, formation by the medial cord, root value C7, C8, T1. Okay, sir. It is running in the axilla. It is running in our arm. How many branches? No branches. It is running medial to the brachial artery. At the coracobrachialis insertion, it is piercing the our medial intermuscular septa, and it is reaching from entry to the posterior compartment. Next point, it is running just behind the medial epicondyle. The many clinical points you have to remember. Due to the position of the ulnar nerve just behind our medial epicondyle, there is a tingling sensation in our forearm. That's why this bone, humerus, is known as the humor bone, funny bone. Next important point here, medial epicondyle fracture, which will result in damage to the ulnar nerve. Also remember, in case of the leprosy, this ulnar nerve is commonly involved here, and it results in the ulnar claw hand. Okay, sir. Now this ulnar nerve is running in our anterior compartment. Here it is passing in between the two heads of the, yes, flexor carpi ulnaris. So just like the pronator teres syndrome, the compression of the ulnar nerve in between the two heads of the flexor carpi ulnaris, it results in the cubital tunnel syndrome. So one more thing, sir, cubital tunnel syndrome, compression of the ulnar nerve in between the two heads of the flexor carpi ulnaris. Now it is running in our forearm. It will supply only the flexor carpi ulnaris and our medial half of the flexor digitorum profundus, and then it is coming towards our hand. Yes, sir, it will pass above the flexor reticula, but here is the one Guyon's tunnel I am going to teach you. So it will pass above the flexor reticula, but above the Guyon's, above the flexor reticula, and it will supply the 15 muscle in the hand, and it will supply the medial 1.5 of the finger on the palmar side. At the dorsum, yes, medial 2.5. So this is our course. Again, with the help of this image, I am going to tell you. See here, sir, ulnar nerve is having the root value C8 and T1, correct, sir? But remember the Gray's Anatomy, the C7 42nd edition update. Now it is giving no branch in the axilla. Yes, it is giving no branch in the axilla. It is running medial to the brachial artery. Then it is piercing the medial intermuscular septa. This is the very important viva question for the first MBBS students. And if you are giving such kind of the answer, then you are going towards the gold medal. Yes. Now it is running behind the medial epicondyle of the humerus. and this is passing in between the two heads of the flexor carpi ulnaris. Sir, here it is giving the branch to the elbow joint as well as the flexor carpi ulnaris. Now you can see it is running medially to the ulnar artery, and here it is giving the branch to the hybrid muscle flexor digitorum profundus medial half. Now you can see, sir, it is running straight towards our hand. Correct, sir. It is giving the branch. Yes, it is giving the dorsal side cutaneous nerve supply. So ulnar nerve is giving the branch, cutaneous branch before the flexor reticula. It is giving the branch for the dorsal side. Yes, different textbook, different data are there. Yes, remember dermatome, these are overlapping in nature. So ulnar nerve is supplying the dorsal 2.5 medial side. Few textbooks they says that dorsal medial side 1.5 only the skin part. So only this portion 1.5 of this finger. Now you can see it is giving the palmar cutaneous branch which is supplying the medial half of the palmar skin. Yes, again there are the lots of the our variation. This ulnar nerve will supply the 1.5 of the finger. Some textbook they will say 1, 2.5. Okay, but better to follow the lateral 3.5 by the median nerve, the medial 1.5 by the ulnar nerve. Yes. Now see here, this is passing above the flexor reticula, and here is the one tunnel studied by the Guyon. So this is the Guyon's tunnel. If there is a compression of the ulnar nerve within this Guyon's tunnel, then it is the Guyon's tunnel syndrome. Getting the point? Yes. Yes, Gulnar, thank you. Gulnar is saying, sir, you are the best teacher. Remember, beta, every teacher is best and every student is best. Only there is a need of the tuning. And yes, right now I am teaching you very fast because you all are having the exam in the 2 month. So we are covering the theory, viva, MCQs, all kind of the thing in quick manner. Okay. जब नई fresh batch आएगी तो हम आराम से इन चीजों को पढ़ेंगे. Fine. Right now, try to catch this one. This ulnar nerve is coming and it is giving the one superficial branch which is giving the our palmaris brevis muscle. So palmaris brevis is the only muscle in the hand which is supplied by the our yes superficial branch. Now can you see there is our yes, remember this branch is supplying the palmar skin, hypothenar means palmar skin, but this branch is supplying the medial 1.5 of the digit. Okay, now look here, the deep branch is supplying to the wrist joint. It is supplying all the hypothenar muscle. It will supply all the dorsal interossei, all the palmar interossei. Yes, it will supply the third and fourth lumbrical, and it will end in the adductor pollicis, which is the graveyard of the ulnar nerve. So you can see it is coming and it is supplying the AFO. These are our hypothenar muscle. Okay, sir. Then it is supplying the our yes 3 palmar interossei. Sometimes they are the 4 palmar interossei. It is supplying the all the dorsal interossei. Yes, it is supplying the third and fourth lumbrical. Sometimes the flexor pollicis brevis, the deep head is supplied with the ulnar nerve. So sometimes the flexor pollicis brevis is also the hybrid muscle, and then it is ending in our adductor pollicis muscle. That's why this adductor pollicis is known as graveyard of ulnar nerve. Okay, so after this we are going to look for the clinical integration. Very important. You can remember this ABCDEFGH mnemonic for the ulnar nerve. So what is this, sir? A for ulnar nerve, B for book test, C for card test, D for ductor pollicis test, adductor pollicis test, E for Igawa test, F for Froment sign, G for Guyon's tunnel test, and H for handlebar palsy. So what are this? See here. First, we are going to look for this our Froment sign. This is also known as the book test. Yes, what I want to tell you, sir, this book test, this adductor pollicis test, and the Froment sign, these all are same. For it, I am going to show you one demo. Suppose this is one book. You have to ask the patient to hold this book. Okay, so usually how any person is holding, sir, this is the way. ऐसे हम book को पकड़ते हैं. What we are doing, sir, we are doing adduction. Means this book test is the test for the adductor pollicis muscle, and which is the nerve supply for the adduction, sir, ulnar nerve, the graveyard of the ulnar nerve, adductor pollicis. So this is the test for the adductor pollicis. Okay, sir. This is the test for the ulnar nerve. Correct, sir. But suppose if any person is having injury in the ulnar nerve, any person is having damage, paralysis of the adductor pollicis, so he cannot do adduction. So wo kaisa karega, sir? He will hold the book in such kind of the way. Can you see? Yes, I'm coming close to the camera. So the person will hold the book. Yes, normally adduction is there, but in this situation, if ulnar nerve is damaged, can you see this is the position? So there is a formation of the angle. Can you see this is the decrease in the angle? Decrease in the angle is known as flexion. Hope you all got this point. So what I want to tell you, sir, this is our positive book test. You can see here, if there is the bending of the thumb, means ulnar nerve damage, adductor pollicis is damaged, and if finger is straight, means this is the proper adduction, normal nerve. So hope you all are getting the point. Now see, this is the book test. If there is the decrease in angle, means it is the flexion, and here it is straight, this is the proper adduction. So this is normal, and here is abnormal because ulnar nerve is not acting. So this is the book test, adductor pollicis test, also you can say Froment sign. Now look here, the Guyon's tunnel syndrome. You all know, she looks too pretty, try to catch her. These are our different carpal bones. You can see this is our flexor retinacula. Below to it, there is our carpal tunnel, and through the carpal tunnel, median nerve is passing. But just to see the 5 structure, 1, 2, 3, 4, 5. These 5 structures, palmaris longus, palmar cutaneous branch of the median nerve, palmar cutaneous branch of the ulnar nerve, as well as ulnar artery and ulnar nerve. These are passing above. So forensic medicine integration, if anyone is doing wrist cut injury, किसी ने सुसाइड करने के लिए ऐसे कट कर दिया, ब्लेड चला दिया, तो ये 5 स्ट्रक्चर कटेंगे, बट दिस ऑल द स्ट्रक्चर्स विद द मीडियन नर्व दे आर डीपली लोकेटेड. तो बेटा ये चीज कट नहीं होगी. फोरेंसिक मेडिसिन इंटीग्रेशन बहुत इंपॉर्टेंट. यस, नाउ सी this our ulnar nerve and ulnar artery, they are also passing through the one tunnel formed by the volar carpal ligament. So this is the MCQ from the your NEET PG exam. Content of the Guyon's tunnel. Yes, this tunnel is known as the Guyon's tunnel on the our hypothenar area. What is the content of the Guyon's tunnel? Remember the ulnar nerve and the ulnar artery. Okay. Now see the clinical portion. हैंडल बार पैल्सी, जो साइकिल चलाते हैं, ओलंपिक मैच की तैयारी कर रहे हैं, दे आर ड्राइविंग द साइकिल फॉर द लॉन्ग टाइम, साइकिल प्रैक्टिस. सो कैन यू सी द अल्नर नर्व इज रनिंग फ्रॉम द आवर hypothenar part. So the bicycle handle, it is causing compression. Can you see the hypothenar part? It is getting compression by the handlebar of the bicycle. So here is the which nerve, sir? Ulnar nerve is here. So ulnar nerve is getting compression by the our handle of the bicycle. So this is our handlebar palsy. This is the Guyon's tunnel syndrome. What is the treatment? Same, the multivitamin tablet, the physiotherapy, then give the painkiller. If not treated, then give the steroid. If not treated, then surgery. You have to cut this tunnel. You have to release the pressure. Getting the point? Now, this is the identify the nerve involved. I told you this is the median nerve. This is the repeat. Okay. Now, see, there is the question. A patient was undergoing leprosy treatment. On a follow-up checkup, the patient presented with the following presentation. Which nerve is involved here? So can you tell me what is the answer? Yes. Tell me, beta. Tell me the answer. So try to answer for this question. Yes, sir. I'm looking. So tell me the answer. A, ulnar nerve. B, median nerve. C, radial nerve. Or D, musculocutaneous nerve. Okay. So tell me the answer. Very good. So here is the answer. Yes. What is your answer? See here, this is the ulnar claw hand, and it is saying about our leprosy treatment. So definitely your answer is A. Yes, Shreya, you are right, beta. You are right. Okay. So now what I want to tell you, the few revision capsules. Tell me which nerve is known as the leverer nerve. Answer is median nerve. Why? Because median nerve is the main nerve of the entry compartment of the forearm. It is supplying the flexor tendon. So when this nerve is getting stimulation, flexor tendon, they are getting flexion. Yes, median nerve is causing the flexion of the elbow, flexion of the wrist, flexion of the finger, and these activities are done by the labor. Yes, for digging, for pitting, for elevating the very heavy weight. That's why the median nerve is known as the leverer's nerve. Remember, ulnar nerve is supplying the short intrinsic muscles of the hand, 15 muscle. So it is responsible for the fine movement. That's why it is doing the music movement. Yes, the ulnar nerve is known as the musician nerve. Which nerve is known as the eye of the hand? Remember, the median nerve is supplying the maximum skin part. Yes, Varun, you are right, but ulnar nerve. So Median nerve is supplying 1, 2, 3 and half of the palm of the skin. So with the help of this median nerve, we can identify the object just by touching. By touching, we can identify this is the 500 rupees or the 2000 rupees or any coin. So median nerve is known as the eye of the hand. The Viva question, yes, previous MCQs. Fine, identify the nerve related with the test. Tell me, book test is the test for what? Sir, ulnar nerve. Card test is the test for what? Tell me, beta. Yes, ulnar nerve. Igawa test, I will teach you. The Igawa test is the spreading of the finger. Yes, this spreading of the finger is done by our ulnar nerve. Okay, so remember, Igawa test, you have to just do spreading of the finger. Do you remember? These abduction is done by the dorsal interosseous, and dorsal interosseous, they are abductor. So that is responsible for our Igawa's test. The basic is our DAB. These all are supplied by the ulnar nerve. And from and sign, I told you the book test. Again, this is for the ulnar nerve. Tinel sign, sir, it is a median nerve. Pointing index, sir, median nerve. Okay sign, entry interosseous nerve. But benediction and deformity, the median nerve. So these are our different points. Yes, card test, you all are aware. We have to ask the patient to hold the card in between the fingers and you have to pull the card. Yes, this is our card test. During the card test, you are asking the patient for the adduction. So remember the mnemonic pad. Palmar interosseous, they are adductor. So these are the different important MCQs for all of you. Yes, Uzma, very nice, beta, very nice. So now in between the session, remember, some may have more talent than you, but there is no excuse for anyone working harder than you. रिमेंबर बेटा कि जब हम इस लाइफ में जी रहे हैं तो इस सिचुएशन में एक से एक ब्रिलियंट लोग आएंगे और वो हमसे आगे रहते हैं. याद रखो कि अगर कोई ब्रिलियंट आदमी है तो उसको पीछे किया जा सकता है. वो 2 घंटा पढ़ता है तो हम 4 घंटे पढ़ सकते हैं, 6 घंटे पढ़ सकते हैं, 8 घंटे पढ़ सकते हैं. ओके, गेटिंग द पॉइंट. तो ये कोई एक्सक्यूज नहीं है कि वो हमसे ज्यादा ब्रिलियंट है. ब्रिलियंसी मैटर नहीं करती, मैटर करती है तो हार्ड वर्क. और याद रखो, मोर इंपॉर्टेंट फैक्ट इज योर कंटिन्यूटी. अगर हम परफेक्ट बनने की कोशिश करते रहेंगे तो वो दिन कभी नहीं आएगा. Continuity is more important than perfection. With this positive line, now we are moving for our next important nerve, radial nerve, the thickest nerve of the brachial plexus. Yes, radial nerve is formed by the C5, C6, C7, C8, T1. All the roots are there. Now, this nerve is running through our spaces of the arm. Getting the point? Yes, sir. It will pass through the spaces of the arm and then immediately it is passing to the posterior side. Remember, the radial nerve is the nerve of the posterior compartment of the arm. It is running through our radial groove and then again it is coming to the front side by piercing the lateral intermuscular septa at the level of the coracobrachialis insertion. Okay, so remember the ulnar nerve, it was going from entry compartment to the posterior compartment. At which level? Sir, coracobrachialis insertion, CBI, coracobrachialis insertion. And radial nerve is crossing from entry compartment to the posterior compartment by piercing the lateral intermuscular septa. At which level? Sir, CBI, coracobrachialis insertion. And remember, the median nerve is crossing the brachial artery from lateral to medial side. At which level? Sir, at the level of CBI, coracobrachialis insertion. I told you the 3 important viva questions for the first MBBS student. Okay, sir. So radial nerve is coming here. We all know there is our median nerve, brachial artery, biceps tendon, and radial nerve. So this is the same our MBBR relation. Now this radial nerve is coming and it is dividing into the superficial division and the deep division. Remember, the deep division will pierce the supinator muscle. Yes, sir. Supinator is pierced by the deep branch of the radial nerve and it will run at the back side. Yes, posterior compartment of the forearm. So this is nothing, sir. This is the posteriorly running nerve behind the interosseous membrane. So it is the posterior interosseous nerve and this nerve is running towards our, yes, anatomical snub box. We are putting the drug abusing substance here and then rubbing here and then in this way. So remember, this is our anatomical snub box. It is very important for the short note for the first MBBS students, and it is very, very important for the NEET PG and the FMG students because 5 clinical points are related with this anatomical snub box. We will discuss in another session. Now try to catch this point. Sir, this radial nerve is coming and it will give the sensory nerve supply to the dorsum part at the base of the thumb on the palmar side and on the dorsum 1, 2 and half. Few textbook will say the lateral 3 and half. And muscles, no sir, on the dorsal side, no muscle is there. So all the muscles of the posterior compartment of the arm, one thing, and all the muscles of the posterior compartment of the forearm, these are supplied by the radial nerve. Better to say, all the posterior compartment muscle of the forearm, they are supplied with the pin. Now, gold medal question, except what? So your answer is mnemonic. A, B, E. Abe. Abbe Saleh. Do you remember that famous actor Moin Akhtar Sahab? Yes, Abbe. So you have to remember that Abbe. A for yes, sir. Anaconius. It is not supplied by the pin, but it is the muscle of the posterior compartment of the forearm. B for brachioradialis, and E for extensor carpi radialis longus. This is very important question asked in your NEET PG exam also. So remember, these are not supplied by the pin, but these are directly supplied by the radial nerve. Getting the point? Okay. So one time again revision. First, you have to describe the formation, then course in the axilla, then in the arm, then course in the forearm, then you have to describe its course in the hand. Okay. So look at this part. Sir, radial nerve is coming from the brachial plexus. First point. Sir, it is the branch of the posterior cord. Second point. It is formed by all the roots. So you can see here C5, C6, C7, C8, T1. All roots are contributing in the formation of the radial nerve. Okay, sir. Now, in the arm, yes, sir, it is running in our radial groove. So just try to understand, sir, this is our humerus. Correct, sir? Here is a shaft. This is the medial epicondyle, and this is the lateral epicondyle, capitulum, and this is the trochlea. So radial nerve is coming, and then it is running in the posterior compartment. Getting the point? So what is happening, sir? It is running within the radial groove, and then it is coming on the front side. Okay. So this is just a simple diagrammatic presentation of the radial groove. Okay. So radial groove is giving the branches. Yes. Above the radial groove, in the radial groove, and below the radial groove. So this diagram is important for the first MBBS students. Above the radial groove, yes. How you can remember? You can remember with the mnemonic. Yes. LMP. Last menstrual period is your mnemonic. What is this L? Remember, it is giving the branch to the long head of the triceps. M for it is giving the branch to the medial head of the triceps. And P for you can remember the posterior cutaneous nerve of arm. It is supplying the skin of the posterior side of the arm. LMP is your mnemonic. It is very important. The course of the radial nerve in the arm. Now, in our radial groove, remember your mnemonic is MLA, and MLA is playing the polo. So your mnemonic is MLA polo. M for yes, it is giving the branch to the again medial head of the triceps 2 times because medial head is most bulky. Then A for yes, L for remember this is our lateral head. There was the long head, here is the lateral head. And A for very, very important, anaconius is given the branch in the radial groove. NEET PG question. And P for posterior cutaneous nerve of the forearm, and L for sir lower lateral cutaneous of the forearm. So these are the points which you will lower lateral cutaneous of the arm. Okay, you can forget these cutaneous branches, but that branches are important. Now remember the branches given by the radial nerve below the radial groove. So you can remember with this mnemonic, yes, baby. You know, below the radial groove, sir, it is giving the branches baby. Yes, sir. B-E. B-B-E-E, B-E-B-E, just like the babe, hi babe, baby, okay, baby ko bhais pasand hai, something like that, Salmon voice song, you know. B for, sir, brachioradialis is given below the radial groove. Yes. E for, you can remember the extensor carpi radialis longus is the muscle of the posterior compartment of the forearm, but it is given below the radial groove. And B for, you can remember our, yes, Mr. brachialis muscle, and E for elbow joint. Yes, brachialis is the hybrid muscle. It is supplied by the musculocutaneous as well as radial nerve. That's why we are saying the Mr. brachialis. So here one branch from our radial nerve. So these are the points how you can remember the different branches. Your mnemonic is LMP, MLA polo, and here is the baby. Okay, so the same thing you can observe here. It is giving the branches, sir. It is giving the branch to the long head of the triceps, medial head of the triceps, and posterior cutaneous of the arm. So L, M, P. These are the branches above the radial groove. Now you will see it is giving the branches to the our, yes, anconeus. It is giving the branch again to the medial head of the triceps. It gives 2 times branches. Okay, sir. And here it is giving the lateral head. So you can see the MLA. It is giving the posterior cutaneous nerve of the forearm. So PO is here and low is here, lower lateral cutaneous nerve of the arm. So that diagram which I form for all of you, that is easier. Now see, it is giving below the radial groove, the brachialis, brachioradialis, elbow joint, and extensor carpi radialis longus. You can remember this is the NEET PG question. Your mnemonic is baby. Okay, now come to the our forearm part. Sir, it is giving the superficial branch, and this superficial branch is giving to the our digits. Yes, skin of the lateral 3.5 of the dorsum part, it is supplied by our radial nerve. But you can see it is piercing. It is giving the deep branch which is piercing which our, yes, our supine intermuscle. Okay, Ayan Verma, roll number 67. So the students who are giving their roll number, you will get extra mark. Okay, Ayan. So very good, better. And inform to all the students. I know this code word. Okay, this code word only the RIMS students can understand. Okay, Ayan, very good, better. So now see here, this is our what? Sir, posterior introsseous nerve, which is giving the branch to the supine intermuscle. Now it is supplying all the muscles of the posterior compartment of the forearm. Yes, sir. It is giving the branch to the extensor carpi radialis brevis, extensor digitorum, extensor digitum minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. How to remember this name of the muscles? We will do different session. लेकिन बेटा कम से कम अभी ये याद रखो, all the muscles of the posterior compartment of the forearm, they are supplied by the pin, except Abbe Sale, ABE, A for anconeus, B for brachioradialis, and E for ECRL. So remember the Moin Akhtar Saab, the great actor. Okay. So now we are looking, this nerve is ending here at the wrist. Sometimes there is the abnormality at this part, and you will see there is the formation of the ganglionic cyst. तो कोई भी बेटा आपके घर में, आपके फैमिली में किसी भी केस में आप देखते हो यहाँ पर डॉर्सम पार्ट में एक एलिवेशन हो गया है, तो वो कुछ नहीं है, इसी रेडियल नर्व में एबनॉर्मलिटी, एंडिंग वाले पार्ट में एबनॉर्मलिटी कारण होता है, दैट इज आवर गैंग्लियन डिसीज. ओके, नाउ ट्राई टू ऑब्जर्व radial nerve compression at the axilla. Sir, radial nerve compression at the axilla, it will result in the many symptom. Yes, जो लोग बैसाखी की मदद से चलते हैं तो उनमें आप देखोगे कि ये रेडियल नर्व का कंप्रेशन बैसाखी के कारण हो जाता है, and all the structures, all the branches of the radial nerve, they are getting damaged. So this is known as, yes, crutch palsy. Now look here, this is the very famous Saturday night palsy. Yes, Saturday की night को party celebrate किए, drink किए और chair में सो गए. So there is a compression of the radial nerve along the edge of our chair. So this is our Saturday night palsy, radial nerve clinical point we are looking, and this is the very famous. And I want to tell you today there was the FMG 2023 जुलाई सेशन, अभी बेटा कुछ 3-4 घंटे पहले खत्म हुआ है. ये रिसेंट क्वेश्चन आपका आया हुआ है. Whenever there is the radial nerve injury, extensor muscle has been gone, so patient cannot extend the wrist, so there is the wrist drop. Getting the point? And now look here, this is another situation, sir. It is our finger drop, very important. Yes, radial nerve is injured, so you will ask the patient to extend the wrist. He can extend, but he is not able to extend the finger is getting dropped. So this is our finger drop position. And now see, this is the one new situation, new clinical. This is our honeymoon palsy. So try to understand what is happening at time of honeymoon. Yes, lovers, they are sleeping in such kind of the manner. So there is the radial nerve compression due to the heavy weight. Okay, so this is honeymoon palsy. It is again related with the radial nerve. I am going to tell you the permanent treatment for this honeymoon palsy. Yes, you can cut the hand or you can cut the throat. This is the permanent treatment for the honeymoon palsy radial nerve injury. I am just kidding, don't take seriously. Okay, so these are the different points. Can you tell me this NEET PG 2019 question? There was the image, here was the arrow, nerve supply of the area marked by the arrow in this image. Tell me which nerve is supplying this part of the skin. This is the question. Comment at the comment box. Okay, so these are our different points. One more thing I want to tell you for the orthopedics integration. Try to understand. If radial nerve is injured here, then what will happen? Radial nerve is the nerve of the posterior compartment of the arm. Orthopedics integration. posterior compartment of the forearm. Yes. So there is the loss of the extension at the our shoulder. No, the extension at the shoulder is done by the climber's muscle, the latissimus dorsi. So it will not be lost. But can you see this elbow extension, this your wrist extension and the finger extension? So these are the three extension. 1, 2, 3. Just like the Michael Jackson. Do this one. This is the Michael Jackson cap. So there is the 1, 2, 3, 4. I told you the 4 movement. Yes. 1, 2, 3, 4. Michael Jackson dancing style, radial nerve injury, high radial nerve palsy, low radial nerve palsy. I'm telling you. So remember, whenever there is the radial nerve injury, high injury, sir, there is a no damage to the our shoulder extension because it is done by the latissimus dorsi and the pectoris major. Okay, so the one is normal. But if there is the damage to the radial nerve at the axilla, so LMP gone, MLA gone, polo gone, pin gone, all gone. So patient will not be able to extend the elbow, not able to extend the wrist, not able to extend the finger. So patient will present with the flexion of the elbow, yes, wrist drop and the finger drop, complete. But if the patient is having injury at the radial groove, so our lateral head and medial head, they are normal. Triceps is normal, so elbow extension will be near about normal. Only the patient will present with the wrist drop and the finger drop. Okay, sir. But if there is a damage of the radial nerve at the cubital fossa, remember, below the radial groove, this is not seen commonly. At the cubital fossa, it is seen commonly. So at this side, so your LMP is normal. Okay, sir. Your MLA is normal. So triceps is normal. So patient can do extension. Okay, sir. And also the brachioradialis and ECRL, they are normal. They are crossing the wrist joint. So patient can do extension at the wrist also. Okay, sir. But patient will not be able to extend the finger. So there is the finger drop. So this is the clinical. Yes, I told you about the radial nerve. One more thing, ulnar claw hand, ulnar paradox. I want to tell you about the ulnar paradox. Try to understand. If there is the ulnar nerve injury at the lower side, remember, whenever nerve injury at the upper side, many symptoms are seen. But if any nerve injury lower side, less symptoms are seen. But ulnar paradox का मतलब क्या होता है? उल्टा. तो ulnar nerve के केस में उल्टा. If there is a lower injury, more symptoms are seen. If there is the higher injury, less symptom. क्यों? If there is an injury at this our carpal part, so remember, at this time there is the our claw hand. Okay, sir, claw hand. But remember, the flexor digitorum profundus is given branch above. तो फ्लेक्सर डिस्ट्रम प्रोफंडस जो है वो नॉर्मल है. गेटिंग द पॉइंट? सो इफ देयर इज अ लोअर इंजुरी, flexor digitorum profundus is normal, so it will cause more and more clawing because flexor digitorum profundus is normal. Yes, our third and fourth lumbricals, they are also normal, so more clawing there. Okay, third and fourth lumbricals paralyzed, so claw hand. But flexor digitorum profundus, the medial half is supplied by the ulnar nerve, so they will cause the flexion, so more clawing you will see when there is a damage at the our carpal part, hand part. But if there is a damage to the ulnar nerve at the upper part, so claw hand will be there. Yes, sir. But flexor digitorum profundus is also paralyzed. So the flexion, the clawing will be less because flexor digitorum profundus is paralyzed. So it is not able to flex the finger. So this is the difference. Upper injury, less symptom. Okay. But lower injury, more symptom. This is the paradox. Hope you all are getting the point. So this all about our today's class. So at the last, it is not my country's duty to push me ahead. It is my duty to push my country ahead. बेटा याद रखना, हमने देश को क्या दिया है, हमें ये सोचना है. हमको ये नहीं सोचना है कि देश ने हमको क्या दिया है. ओके, स्टेबल बनिए, पढ़ाई लिखाई कीजिए, अच्छे से एग्जाम दीजिए. हमारी पूरी सेरेबेलम टीम आपके साथ है और हम आपके साथ खड़े रहेंगे इस एग्जाम को अच्छे से क्रैक करने के लिए, हमेशा हमेशा के लिए. हमको ये सोचना है कि हमने देश को क्या दिया, ये नहीं सोचना कि देश ने हमको क्या दिया. सो थैंक यू वेरी मच. गॉड ब्लेस यू ऑल. एनी डाउट बेटा, प्लीज आस्क. Actually today there is our FMG session. Okay, that's why we have to close this session soon. Any doubt, please ask better. This is the rapid session for all of you. Hope you all enjoyed and get ready for our upcoming session for the physiology and our biochemistry part. You will enjoy too much. Okay. Yes. Thank you, Shreya. Thank you. God bless you. This annotated file will be available in our app, Cerebellum Academy app. Okay. So I want to leave राइट नाउ बेटा, क्योंकि अभी तुरंत हमारा एक अगला सेशन चालू होने वाला है जिसमें आज ही एफएमजी का एग्जाम हुआ है. तो उसमें सारे जितने भी क्वेश्चंस थे वो किस तरीके से हमारे पढ़ाए हुए टॉपिक्स से आए, उनका एक एनालिसिस पूरे 19 सब्जेक्ट के महारथी करने वाले हैं. तो बिल्कुल भूलिए नहीं, 8:30 को हम लाइव हो रहे हैं, सारे के सारे 19 सब्जेक्ट टीचर। तो अभी मुझको इजाजत दीजिए। फिर से जाते जाते सिर्फ हंगामा खड़ा करना, सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं। कोशिश है कि सूरत बदलनी चाहिए, हमारे सीने में नहीं तो तुम्हारे सीने में ही सही, कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए। जुड़िए हमारे फर्स्ट प्रॉफ सेशन के साथ, हम अभी खूब इंजॉय करने वाले हैं और एग्जाम को हम बहुत अच्छे तरीके से क्रैक करेंगे और साथ में गोल्ड मेडल भी लाएंगे। थैंक यू वेरी मच, गॉड ब्लेस यू ऑल द बेस्ट।